how do you decide when the patient can come off of that therapy?
Yeah, so that's a good question. So normally we use these drugs for aspergillus in the neutropenic patients, and there are no studies to show how long, but most of us will continue for 2 to 3 months on treatment, number one. Number two is depending on how the patient does. He actually responded really well. Within like 10 days, he was so much better. It was, I walked in a room and it's true what he was saying. It was a different person. It was a bearded person, but it was a different person that was on there. And then one day I finally came in and he was actually extubated, not extubated, but not connected to the mechanical ventilation. And that was an amazing thing to see. So about that time also, we started loosening up some of the caregivers coming in, right, Angela, later on. So they were able to visit when he was there. And that totally not only improved the morale for the people taking care of him, but his morale changed completely. Because something else that we don't talk about is COVID in the ICU, or anybody in the ICU, they start to develop this anxiety and panic and depression, which we had to deal with at this, and I'm sure they can tell you that at the same time. But once he was able to see family close, that he was awake and alert and at least looking at him, it was a different person. But the anxiety and panic that he had was pretty significant. Even upon discharge from the hospital, there was still some anxiety, obviously going somewhere else, right, at this point. And that was a big impact on him. You can ask them, but that was significant.